Hi, I'm Andrew Adams. I'm an abdominal transplant surgeon here at the University of Minnesota, and I specialize in liver transplants in adult and pediatric patients. I think what drives me is the ability to impact patients' lives, to really consider them as someone like my own family member, coming in the state of illness and being able to seek treatments to be better, that our team is able to deliver the best possible care for them, and then also look to the future, looking at opportunities to improve treatments, really help them get back to having a normal life. The best part of my job is seeing those patients in the clinic afterwards where they were sick when we saw them before. Now they're returning back to health, being able to return to do all those activities that they were doing before, enjoy the time with their family, and being able to just return to health and vitality. I chose academic medicine really because I've had an interest in immunology, my whole life, really studying the science, what drives the immune system to reject an organ transplant or prevent an infection, and how can we study the immune system and manipulate that so that it will accept the organ but then preserve the ability to fight off infections. It also has allowed me to look at the limitations in transplant. As transplant surgeons, we're able to see the problems that happen, with our patients, and what are the limitations, including the crisis in the organ shortage, the limitations with the immunosuppression drugs that we use. So going back to the laboratory, we're able to study opportunities to be able to solve those problems and really affect the lives of our patients, including using things like xenotransplantation or genetically modified pig organs to expand the number of organs that we have for people, so there isn't such a long waiting list and people can be able to get a transplant and go back to their normal lives. I love what I do when I come to work every day, mostly because of the opportunity to interact with patients and really have a role in the transformation that they have from sickness to health. Probably the favorite part of my job is to see patients come to the clinic after their transplant, feeling better, back doing the things that they do in their everyday life with their families and friends, and be able to be a part of that. I also get to see the limitations that we have in transplant, the organ shortage of organs, the limitations with the immunosuppression drugs, and then be able to take that and go back to the research lab and really discover kind of new strategies, new protocols that will allow us to help patients do better in the future.